You probably came to this video because you're thinking about starting Zepbound, semaglutide, Ozempic, Wegovy, one of the GLP-1 agonists, or you don't know where to start. I'm Dr. Hassan, I'm a board-certified trauma anesthesiologist. You have to watch this video before you start these medications. Now let's go over some of the basics. The GLP-1 agonists affect either 1, 2, or 3 different receptors inside your body. How do they work? They typically work by slowing down digestion, giving you a feeling of being full longer, therefore in turn decreases the amount of food that you eat. And once you decrease the amount of food that you eat, you start to lose weight and you have a positive reinforcement cycle. The problem with Zepbound, Ozempic, and all these medications, they have a lot of side effects. Most of the time, you don't get a guide to kind of tell you how you should eat, what you should eat, how you should maintain your muscle. These things are important because most of the time you're going to get people who prescribe you the medication, but they don't really give you a guide. How do you work out? How do you eat? What do you eat? How do you go about your day? This video serves to help bridge that gap. Now, as soon as you start any of these medications, whether it's Zepbound or Wegovy, you're going to have a 1-week delay period. So typically for about a week, your body's going to get used to this new hormone being injected into your body. More than likely, you're probably going to be more hungry and eat more, maybe even put on 5 pounds. This is normal, and then eventually it's going to fall off of a cliff. And what you have to understand is these medications slow down your digestive process. So any foods that you eat are going to be stuck in your stomach even longer. What you also have to understand is eating foods that are fried and have a lot of fat content are going to increase the amount of stomach acid, bile acids, and the amount your GI tract is going to have to work. Now just remember, these medications slow down the process of digestion. So all that food that's inside you is going to take a lot longer to get through. If you eat a lot of foods that are fried, high fat, high calories, they're going to stick around longer in your stomach, and they're going to cause your stomach to work harder. When your stomach works harder, it's going to produce more acid. That's when you end up having indigestion. You have really bad heartburn. It's because your stomach is sensing the food that's in it and it's trying to break it down, and it's not passing all the way through your GI tract. It's totally normal. What you need to do as a patient is change the type of food that you eat. You want to eat less fried. You want to have more fiber. You want to have more salads. You want to do your best to stay off the Doritos or the Pepsis. Typically, these medications also affect your brain and they decrease the drive and necessity for the dopamine hits. However, if you're used to eating fried chicken or you're used to eating apple pie, at the end of the day, those foods will sit inside your belly a lot longer and they'll lead to the acid reflux. Tip number 2, you're going to lose a lot of muscle while on these medications. There's only one real way to prevent this. The only way to prevent this is to eat the adequate amount of grams of protein to your body weight. Typically, they strive for 0.7 to 1 gram per kilo of body weight. So if you weigh 100 kilos, if you want to maintain your muscle, you're going to have to eat 100 grams of protein. This is not easy to do, especially on these medications. That's why in your head, you have to kind of repeat to yourself, hey, I need to get this protein in. Now, obviously, the quality of the protein also matters. If you can, try to eat organic. If you can, try to eat grass-fed. Try your best not to eat anything that's processed, soy meat. But that being said, you might have to supplement yourself. So you might have to take a collagen shake. You might have to take a protein shake just to hit the number of grams necessary to maintain your muscle. It's very typical when you start these medications, you're going to lose weight and you're going to lose muscle mass. And that is directly correlated to the fact you're not going to work out, you're going to be tired, you're not going to eat enough protein. For older folks, this is very important that if you do decrease your muscle weight, you have an increased chance of falling, getting injured. And we all know that if you break your hip, it's a recipe for disaster after you turn 65. So if you start these medications after the age of 65, you have to remember that you want to keep your muscle weight and you want to keep your muscle strength. You have to go to the gym, even if it sucks. You have to do your best to eat the right amount of protein and stay adequately hydrated. Tip number 3, these medications are going to decrease your drive to eat. That's not something that you want to continue for the rest of your life. 99% of people who take these medications are going to want to lose weight over the long term. What you want to do is not become dependent on these medications. Use these medications as a tool. What do I mean by a tool? I mean use it for a purpose. That purpose for you while watching this video is to lose weight. You want to be able to maintain that weight loss. A recent study just showed that 20% of people who stop the medication gain back even more weight. What did they do wrong? In my head, it boils down to the fact that those 3 months that they were on the medication or 6 months that they were on the medication, they were using it as a crutch and they were not using it as a tool. You want to teach your body, it took you 20, 30 years to gain the weight that you gained. You want to reteach your body that, hey, I can have a salad for lunch. Hey, I can have eggs for breakfast. Hey, I can eat some protein and be satisfied without having it be fried or having it have excess calories. Use these medications to reset your brain chemistry. Your brain chemistry has been conditioned over years and years and years of eating addicting foods to want to crave Doritos, to want to crave fried chicken, to want to crave an ice cream cone at the end of the day. But you want to do your best, especially in this situation situation. You've taken the first step. You want to lose the weight. You want to keep that for the rest of your life. What you really want to do is retrain your brain, because once you come off these medications, if you keep your body weight low, your blood pressure will do better, your chance of stroke will go down, your chance of diabetes will go down, the amount of energy you have will go up. So it's very imperative, if you're on these medications, do your best to try to change your brain chemistry to eat healthier foods. If it was me, if it was up to me, this is what I would do. I would take the first 2 to 3 weeks while I'm on these medications and just try to lose weight. After my weight starts to downslope after week 3 or week 4, that's when I start to train my brain. Start to introduce healthy foods, maybe once a day, maybe for just lunch. You have a salad. Then in the mornings, you start to have eggs. Then in the evenings, you start to eat something healthy like a ground beef or ground chicken. It doesn't matter what you eat as long as you have purpose behind it. That's how I would try to adapt. And once I've established an ability to eat healthier foods, I would start to supplement with protein. This might suck because a lot of the times healthier proteins don't taste good without condiments or sauces. But in the long run, if you could change your palate to be attracted to these kind of foods, there's a very high probability that you'll be able to keep the weight off, keep your muscle up, and be able to function much more better in life. So those are 3 tips that I think everybody should do, especially when they're on these medications. However, the one caveat is, if your primary physician, if the person who's prescribing the medications gives you some sort of other guidebook, guideline, follow them, because they know you a lot better than I know you. You might have diabetes, you might have low blood sugar, you might have really high blood pressure. Trying to tailor this algorithm for everybody is impossible. So listen to your primary care provider or your weight loss specialist and follow them before you follow some random guy on the internet. I love you guys. Please, if you can, it's pretty early in the morning. I'm trying to record before I go to work. Like and comment below. I'll see you guys on the next one.